My name is John Sherman. I'm a plastic surgeon in New York. My office and surgical facility is located across the street from the Metropolitan Museum of Art, which is well known on Fifth Avenue. I've been in practice for over 30 years. I currently teach at New York Presbyterian Hospital, Cornell University Medical Center, where I'm also on staff. I'm a board-certified plastic surgeon in New York. I'm a member of the American Society of Plastic Surgeons, and I'm currently vice president of the New York State chapter of the American College of Surgeons. As you may be aware, there's been a lot of news recently about the PIP implant, which is made in France. A good portion of these implants were made with non-medical grade silicone. So the problem is that this non-medical grade silicone can be cancer forming, and the long-term effects of the silicone really are unknown. The French government has taken a stand and decided that these implants can be removed, and if they are removed, the government will pay for the removal of the implant, providing that you are a French citizen and it's done in France, or if you're a French citizen and it's done abroad. However, if you are an American or other foreign national, that does not apply. So this PIP implant really does not relate to Americans who have had implants placed in the United States. It does relate to Americans or any other foreign national who lives here who did have an implant placed elsewhere. The problem is, unless you really have documentation of the implant that is used, it should be suspect. Even if you have a PIP implant, you do not know whether or not the medical grade silicone was used or the non-medical grade silicone was used. So the advice to many people is remove the implant and either have it replaced or not. The purpose of this video is to reassure you that this procedure is quite self-limited, it's simple, it's rapid, and the patients really suffer no ill effects from the operation. We're fortunate enough today to have the ability to show you the actual removal of a PIP implant. This patient is sort of a world traveler, came from South America, and at that time she went to France to have her implants placed approximately 3 to 4 years ago. She was notified by her physician of the problem with the PIP implants, as well as reading it in all the world literature. The operation itself is quite simple. Although the patient had her implants placed through the areola, that's a circle around the nipple, we chose to make the incision below the breast mound because A, she decided it would be better for a scar and doesn't want to go through scarring. And also it's easier if the implant actually is ruptured, that the silicone is removed without going through the breast. The operation is about an hour. We've edited this video to make it brief and easy to follow, and you will follow the removal of the implant and the closure. The patient is on the table. The implants are visible, and incisions made below the breast at the interface of the chest wall and the breast, so the scar cannot be viewed. A very small incision is made, about 3 to 4 centimeters. This is carried through the tissue until we see the blue of the capsule, which is the tissue surrounding the implant. An incision is made in this capsule and the implant is removed. We can see here upon removal of the implant that indeed the implant is intact, and the label does say PIP and the size, which is 150 cc's, which is quite a small implant. The closure is accomplished easily with removal of the capsule and scar tissue first, and then suturing the incision. There are no external sutures placed within the incision, so the patient can return in approximately 1 week to wherever they came from and return to work. We will follow the patient for the next few days in the office and discharge her as necessary. As we noted before, approximately 50% of these patients are able to go on without implants and indeed are very happy to be free of the problem, and about 50% have difficulty adjusting to their new image and seek to have a new implant placed at a later time. Just trying to put things in perspective, this small excerpt that we've discussed about the PIP implants really has very little bearing on most implant patients. The vast majority of implants around the world were not PIP implants. So my advice is, number one, speak to your surgeon. If you had an implant placed here in the United States, I would not worry because they were not FDA approved. Check your card that you're supposed to have, make sure that it is an FDA approved implant. If you are one of the foreigners who are done abroad, or an American who with medical tourism has gone abroad for an implant, then speak to your surgeon and find out the manufacturer of this implant. And at that time, make a decision with proper advice whether or not to proceed with explantation.